Today, sir, I'm Junalyn Shasat, student from St. Augustine School of Nursing, under Caregiving Program. I am here today performing a range of motion exercises that performed by patient himself. In case of helpless patient to memorize all joints through their full range. Range of motion exercises are those in which a joint is moved through full range of motion according to its capacity. There are two types of range of motion. First, active, done by patients by itself. Second, passive, done with help or assistance from other person. The purpose of range of motion to increase muscle strength, endurance, to maintain psychological function, to prevent complication caused by mobility of light contractors, to improve physical activities, to increase joints flexibilities. Well, I'm Junalyn Shasat, your aide for today. With your range of motion exercises, first I am doing to do is make sure that raise your bed working high level and put the bed flat. I washed my hands already before I came to your room. Flexion, extension, flexion, extension, flexion, extension. Next, I will do extension, flexion, and hyperextension. Flexion, extension, hyperextension. Flexion, extension, hyperextension. Now, work your thumb. Abduction, adduction. Abduction, adduction. Abduction, adduction. Abduction, adduction. Abduction, adduction. Flexion, extension. Flexion, extension. And repetition of little finger. Flexion, extension. Flexion, extension. Next, radial and on flexion. Radial flexion, on flexion. Radial flexion, on flexion. Radial flexion, on flexion. Radial flexion, on flexion. Now, I will work your flexion, extension. Flexion, extension. I will do supination and pronation. Supination, pronation. Supination, pronation. Are you ready to work your leg now?
Yes.
Okay, now I will going to expose only one leg. And I will start working on the hips first. I'm going to do flexion and extension. Flexion, extension. Flexion, extension. Abduction, adduction. Abduction, adduction. Let's go to your ankle. Flexion, dorsal flexion. Flexion, dorsal flexion. I will perform to your toes. Abduction, adduction. Abduction, adduction. Work it those individual. And then flexion, extension. Flexion, extension. Flexion, extension. I will then reposition the patient for comfort. Put the bed back in low position with the head of the bed at 30 degrees. Anything else that I can do for you, sir? Okay, I will wash my hand and record and report.